all cancers in the UK and in most modern countries are now discussed in a multidisciplinary team or tumour board, and that was invented years ago to prevent people just seeing one specialist and having one opinion. So the idea is that you have lots of different specialists, so that might include radiology, oncology, gastroenterology, nuclear medicine, biochemistry, and nursing staff. So lots of different specialties. So they would sit around in a room and discuss the patient's details and hopefully come up with a sensible plan that includes everyone's views, because the views may not be quite the same between different doctors. So you're never going to get exactly the same opinion from several different doctors, but hopefully you can take an average view.
I think that the development of a multidisciplinary team has dramatically changed cancer care, and neuroendocrine tumour care is no exception. I think having all of the specialities that could be involved, which includes surgery, radiology, oncologist, endocrinology, nurses, dietitians, etc., really allows for the clinician in charge of the patient's care to give the patient all of the information. It may be that there's only one choice for some patients. However, there is also many choices for a lot of patients, and it's about using the right tool at the right time. And the MDT provides a good selection of specialities to offer their opinions, and my role as a nurse specialist within that can be, I act as the patient's advocate. So for patients that are new, it's about getting all the information, and then I translate that into English and discuss it with the patient, and help them to gain some sort of understanding about their condition and then the treatment options. For patients who are already diagnosed and we are wanting to decide what treatment to do next, my role again is to translate that, but in the meeting itself is to really give the full picture. Yeah. So, I will know the patient, I'll know what their goals are in life, I'll know what they do in their life, their performance status, which means how fit they are they up and about, are they working, because the treatments can impact all of that, as you will have discussed. So within the MDT, that's my role. I present cases of patients that I want to discuss. So I really think that nurses play an active role in MDT, and the translational aspect from the MDT to the patient.
I think the treatment and assessment of NET patients is proceeding rapidly and advancing really rapidly, and it's quite difficult for people in local hospitals to keep up with all that. So I think we must endeavour to give equal access to all the patients across the country. So although the patients don't necessarily need to travel to a centre that's got recent expertise of NETs, I think it's very important that they're discussed in a multidisciplinary team in that centre. So for instance, their pathology slides and scans and other imaging and biochemistry data might be sent to the multidisciplinary team centre, and then it will be discussed and a plan of management. And many of those patients would want to visit the centre, so they should be given the option to visit the centre and visit NET specialists if they want to. Some patients may not need to, and some patients may decide against it, so they may stay local but have their cases discussed in the central place. And I think it's really important that we give the patients access to the most recent scans and the most recent treatments that are available now, and they change practically every month. So it's really important that that we get the message across. So the message is, with your organisation, is being given to the patients that they need access to the latest treatments, and I think that the medical fraternity should strive to help with that.
I do feel patients should be involved, or patient representatives, or through the Patient Foundation should be involved in shaping services for neuroendocrine tumour patients. And after all, it's just a patient-focused service, or should be a patient-focused service. And certainly through our processes in Wales that we're going through, we have patient engagement, and I feel that's very important. And I do feel that the Patient Foundation do a good job in nationally and within the regional groups, and certainly in Wales, in raising awareness locally. So I think it's a very positive move, and I think we're moving more towards that, hopefully, as clinicians.
Well, I think potentially they're a very important voice, actually. Although neuroendocrine tumours have kind of been considered as relatively rare tumours in the past, it's now becoming very apparent that actually there are a lot of people around with these conditions. The prevalence is actually much higher than the actual incidence of the disease, because people often obviously live with the disease for a long time. It's kind of a chronic condition often. So I think there is the potential for a very strong patient voice and a patient lobby to argue the case for provision of treatments that we know can be very, very effective, but are certainly expensive, and there are obviously challenges in terms of getting the government on board to recognise that these are important tumours to treat. And the situation in the UK at the moment is a difficult one, in that the funding is under a lot of strain, and we no longer have access to some of these treatments that we have done in the past. So I think the patient voice is going to be very important in trying to lobby government to bring this up the agenda.